Americans still reeling over the revelations that the federal government used Twitter to restrict freedom of speech in the press to censor legitimate scientific debate over the nation's management of COVID-19. The revelations being made as Elon Musk continues to pull back the curtain over the influence the White House and other agencies had over canceling doctors, reporters, and other Americans who bucked the Fauci model for handling COVID. Here to discuss the impact of this on public health and medicine generally, we're joined by Jake Denton. He's a tech policy fellow at the Heritage Foundation, and Dr. Manny Sehti, founder of Healthy Tennessee and a prominent trauma surgeon. Jake, I want to go to you first. We kind of knew that this was likely going on, but the evidence now continues to come out of what we learned about how Twitter, the White House, the CDC, and others handled COVID-related speech. And I don't want to get into specifics about policy here necessarily, but what stood out to you?
Well, I think, first and foremost, what's most alarming is how formalized the process was, whether it be just sending Excel spreadsheets of accounts that the White House deemed problematic to Twitter's content moderation teams, or, these weekly kind of industry calls that they kind of refer to them as. There were just processes in place to where, the federal government had a direct line of access to the content moderation team to make sure that there wasn't a snowballing effect of kind of dissenting opinions on the platform. And so a lot of this was done through kind of the purpose of narrative cohesion. It wasn't really done for, public health or policy execution. It was done for, making sure things fell in line with the White House talking points.
Dr. Sehti, I'm so glad you're with us today, because this is really corrosive when it comes to medicine generally, because it sets a tone for American medicine. It sets a precedent. First of all, this was done really to justify, I would assume, mandates of different kinds. And that flies in the face of basic patient management. Tell us why, because we're all different. Talk to us about how it impacted the process.
Well, thanks for having me. And, I very much agree with Jake's sentiments. Look, from the time you are a pre-med, before you even go to medical school, you're taught the scientific process. In medical school, that's really reinforced on how you treat patients, on how you think about different therapies and therapeutics. And what happened with COVID and these mandates was that, effectively, we just threw the scientific process in the trash with this government collaboration with Twitter. And why that's so important, let's just, for example, take COVID out of it for a minute. Let's say we're talking about another virus. Let's say we're talking about the flu. When you treat patients, you treat folks on a one-by-one basis. And it's sort of a collaborative model of like what you think is the doctor, what the patient wants to do. You use your experience, you use scientific data and the number of articles that have been published. And with COVID, we just threw all of that out the window. And so what I am so fearful of in the future, as you mentioned, Tom, is that, are we going to effectively just lean on the government now for the government to become your doctor? Or are we going to embrace, what has been centuries of advancement in science and technology, in therapeutics, and use the experience that physicians have to treat patients? But we just didn't do that during COVID.
Yeah, and I know a number of doctors, and they read the journals, they read the research. You're constantly absorbing new information, and of course, as you point out, we're all different. You don't treat everybody the same, and that is what the government tried to do here. Jake, it was just phenomenal. You had people in the Philippines in like banks of rooms trying to make decisions. You had, bots, sort of computer AI programs making decisions about the censorship of dense medical data and legitimate scientific debate. So you have government using Twitter to shape a narrative, and then foreign banks of people and robots enforcing it. What do you do about preventing this from really being the future of so-called free speech in America?
Well, I think that first and foremost, we need to stop these public-private partnerships of content moderation. There shouldn't be external partners, kind of forcing Twitter's arm to, censor things. When Twitter deviated from their kind of traditional content moderation framework, bad things happen, whether that be COVID or election interference narratives. When they opened the door to these external forces moderating the content, things went awry. Accounts that were banned that shouldn't have been. Across the board, basically we had bad actors take advantage of this window they opened, and they just failed to close it, and so it snowballed through the election and into COVID, and it's starting to close now, but you still see these kind of baseless ban waves. And it's something that until you kind of separate the government from kind of these private sector social media companies will continue to happen.
Yeah, absolutely. Dr. Sehti, as you were discussing, science is about discussion. It's about taking data and learning from it, and we didn't do that in this country really during COVID. It was kind of a false consensus driven by government and censors. But the impact on medicine generally, are people in the medical fields realizing that there was that breakdown, or have they acquiesced to this dangerous new normal?
Well, that's a great question, and I just want to come back to something you said, because it's so important, Tom. Is that, look, as a doctor, I am constantly reading, constantly changing the way I practice. The way I manage a polytraumatized patient with multiple injuries is different than I did 10 years ago based on the science. To answer your question with regard to the physicians today, what you're seeing is that you have a group of doctors who've changed, and they've become, they're embracing these woke ideologies. They're embracing, the government's sort of telling physicians what to do. But then you have a whole other group of physicians, I think the vast majority, that are very concerned by what happened, and very concerned by government interference. And if you recall, there was a time when there were medical boards across the country who were threatening to take doctors' licenses away if they prescribed, for example, ivermectin or hydroxychloroquine to patients, or any other therapeutic. And so I think it's just a very, very concerning thing that happened. Yeah. And as we move forward, we just got to think about it.
Well, hopefully people aren't afraid, and they will push back against those medical boards and against public health if they try to take away physician independence. Real quickly, Jake, Alex Berenson was one of the folks that was canceled by Twitter at the behest of the White House. He sued. He got a settlement from Twitter. Is there recourse for people here whose reputations were damaged by the censorship? Real quick for me.
Absolutely. I think this is the foundations of our social credit score system, right? If you go to someone who's been banned on Twitter, it says, this account has been suspended. And, what we're finding is that oftentimes that was by request of our own government. And so that is an encroachment on our First Amendment rights. And ultimately, I think there will be a big wave here of suits now with these revelations coming from the Twitter files.
All right. Jake Denton and Dr. Sehti, such an important conversation. Thank you so much for being here. Appreciate it.
Thank you.
Thanks.